I wouldn't cut anything in my department. When there's no cabinet secretary, with the exception of maybe one, is Linda McMahon. There's nobody else, I think, in the cabinet who wants to see any of their budgets cut. We also support the president because, you know, I understand, and I ran for 2.5 years for president, and the Americans are concerned about the budget deficit. We have a $34 trillion debt now. Within 5 years, 50% out of every dollar we collect in taxes is going to go to servicing the debt. Within 10 years, that's 100%. And we're leaving this debt to our children, which is going to diminish their capacity to get health care and good food and all these other services. Oh, national debt is a social determinant of health. And I admire the president because it's not popular for any politician to stop spending money that's not his. And he is doing things that are very, very difficult and very controversial and looking down the road and doing something that all of us know has to be done, but none of us knows how to do it. But having said that, he is particularly concerned about rural health, and I ran on that issue, and it's probably the issue that I talked to more senators about, Democrat and Republican, when I was going through my confirmation process. And one of the answers to that, I think it's a really good one, is this provision for rural health transformation provision in the big, beautiful bill. And Dr. Oz is going to be here, I think, today. I think so. Talking about that, and it's a $50 billion payment now, and it's going to improve rural health. This is a lot of money. It's $10 billion a year for 5 years. To put that in perspective, we spend about maybe 6 to 7% of our Medicaid budget on rural hospitals. So that's about $20 billion a year. So this is $10 billion a year that is going to go to rural health. So it's not trivial. It's going to raise the revenues of rural health care providers by 30% over the next 5 years. Dr. Oz will talk about the details of that, but every state will get money for it. Some will get more, some will get less, depending on the quality of your application and your arguments. The money has to be spent by the end of this year, so it is on a very, very fast track. The applications have to be in by September, and it's going to go for infrastructure improvements, for workforce improvements, for innovation,